Martha. That's incredibly enlightening. And our last speaker for the first part of this session is Enas Mustafa. She is the director of Sudan's Ahfad Trauma Centers. She is running trauma centers at 7 locations around Sudan, including the Darfur region. And we are absolutely thrilled that you're here with us today, Enas. One of the things that's coming up a lot in the question and answer feed as the speakers are speaking is some global policy recommendations for the overarching trends that we're seeing in terms of violence against children. So we're looking forward to hearing your thoughts now.
Hello, thank you all. And thank you, Ruth, for the opportunity. I hope you can hear me loud and clear. Yeah, thank you. So I will speak about Sudan. And in my presentation, I have few informations about the current situation in Sudan that most of the people, they don't know that what's happening in Sudan. So I'll speak about the war in Sudan, the civilians' impact and displacement, and about the trauma center. And my name is Enas Hadi, and I'm a mental health specialist, and I work at the Ahfad Trauma Center. I'm the head of the Ahfad Trauma Center Outreach Office in Sudan. So basically what's happening in Sudan since 15th of April, 2023, a violent war erupted in Khartoum, Sudan capital. And the war started between SAF, the Sudan Armed Forces, and the Rapid Support Forces, the militia. So the war beginning in Khartoum, the capital, and then spread it in the national-wide in the around the states. Definitely, due to the war, hospitals, markets, schools, and water and electricity system, they were destroyed. And Sudan now is facing the world's largest internal displacement crisis and also a refugee crisis. Millions of people are trapped with little humanitarian access, those who are in the camps inside of Sudan. But definitely the numbers are different. So the humanitarian impact on the civilians, that 9.5 million internal displaced people, which is the largest number ever in Sudan. So that mainly people moved to the other states for their relatives, but not a massive movement or any forced displacement, what was happening. 3.44 million refugees in neighboring countries. The hosting countries are within the border, sharing the border countries that from the beginning of the war, the Khartoum airport stopped. So the movement was land border movement, so that the most close to the border countries, those who were receiving the refugees from Sudan. And half of the displacement or displaced people are children and women. Civilians face hunger, trauma, loss of homes, and lack of care. And definitely in Darfur region now, the SAF are using the starvation as a weapon of war for the civilians who are trapped there. And also the use of sexual violence against women and children is being used as a weapon of war for the children. And also the issue of kidnapping women, kidnapping children, and making them like slaves at homes or sex workers or households. Many IDPs lived in overcrowded shelters for those who are in camps in around the states. The situation is chaos for majority. So this is a map of Sudan for those of you who don't know. So Khartoum, the war started in Khartoum and then moved to Jazeera state, and then some part of the region of Blue Nile, the Sinnar state. And then it's all about, now it's all in Darfur region and some of Kordofan region. And if you see that the majority of the hosting countries or the other hosting countries like Egypt, Libya, Chad, and South Sudan, and also we have refugees in Ethiopia. and yeah, and Chad hosting the majority also because they sharing border with Darfur. So the people from Darfur region moved across the other uh, country. If you heard about the catastrophic situation for the Sudanese people in Chad refugee camps, it's disaster. And also for those who are from South Sudan, also they are living in disaster in the refugee camps there. So yeah, so these are the most affected regions in Sudan: Khartoum, Jazeera, Blue Nile, Darfur, and Kordofan. Uh, the other states also are affected by the forced displacement that happened in Sudan, especially for those in the Port Sudan and Kassala state here, and the northern state, all the northern state also hosting a lot of IDPs. So, as what I said, I work at the Ahfad Trauma Center, and we are a specialized trauma center providing specialized trauma services. The center established in 2012 at Ahfad University for Women. It's seconded from School of Psychology and Preschool Education under the Trauma and Community Counseling Program. So we provide trauma counseling, community outreach sessions or community outreach activities, and we provide clinical training for professionals and for lay people also. So the trauma center used the model for trust, which is a trust model, which is trauma resilience, upscaling services and training. For the current situation during the war, we tackle the short intervention models, that the telecounseling, the resilience building, the mobile platform to reach IDPs, refugees, women and children. So the services provided for all the communities, including children. We have specialized trained cadre that offers trauma-focused CBT and narrative exposure therapy and teaching recovery techniques. These techniques are for children used in the camps. So we operate mobile clinics, and we also do GBV responses and training programs for activists and social workers and whoever working the humanitarian sectors. So we are the Ahfad Trauma Center is now a key lifeline during Sudan 2023 war due to a lot of we already have a gap in mental health facilities in Sudan. So after the war, many cadre were out of Sudan. The health facilities itself, it's destroyed, and no proper treatment or no proper care for children or adolescents or even women. So Ahfad Trauma Center, we're trying to provide the best services that we can do. So the trauma center we operate in Durman, which is in Khartoum, the greater capital Khartoum, and we work in Kosti, which is the capital for White Nile State, and we work in Gadarif State, we work in Kassala State, we work in North and South Kordofan, and in Blue Nile and North Darfur. And recently, unfortunately, we lost the connection with the South Darfur, with the North Darfur's center due to the RSF are taking control of Darfur now. So its access is extremely limited in Darfur, and also the provision of services, especially that they have destroyed the main only hospital specialized for providing GBV services for women and children. So these are some pictures for the current situation for those who never seen or heard about the situation currently in Sudan. Pictures from the camps and picture for this is hospital had been destroyed and ambulances are being burned and children are scattered. And yeah, these pictures from the UNFPA and UNHCR and and IOM also have shared one of the pictures. So this is the contact information for the trauma center for whoever would like to contact us. And thank you for caring about Sudan and asking about Sudan and for the opportunity to speak about Sudan. And this picture is also from Sudan, the peaceful Sudan before the war. And it shows the confluence, the Blue Nile and White Nile confluence. And thank you.